Hi, I'm Trina Deiss. I am the MNRI specialist here at Newbridge, and I began my career actually as a teacher. I was an educator and a coach and personal trainer for over 15 to 20 years, and that began my journey into bringing kind of well-rounded wellness to people. And then towards the end of my teaching career, I decided to go back to college, and I became an RN. Now, we have an organization outside of Newbridge called United One Front, and we bring support and training to caregivers of kids from hard places. So through that, we encountered MNRI, musculoskeletal neurosensory reflex reintegration. It's a mouthful. MNRI was developed by Dr. Svetlana Muscatova. She's from Russia and studied the way our neurological system impacts the homeostasis of the body, and through that developed several modalities. Now, MNRI is really intriguing in that it helps a vast array of issues, whether it be ADHD, psychological issues, all the way to immune difficulties. And you say, well, how can one modality or one therapy treat on multifaceted levels? And the reason is because under the umbrella of MNRI, we have several modalities that specialize or target different situations. Orofacial, for example, dealing with all the cranial nerves. That would be speech, it'd be eye tracking, dyslexia, breathing, immune disorders through the sinuses, and also through the craniosacral connection that we also have. Then you have neurostructural, which looks a little bit like a cross between chiropractic care and very deep tissue massage or acupuncture or acupressure points. And that deals with the structure of the body. Then we also have the reflex reintegration. So reflexes are the primary modality that brings survival to us as human beings. So we are born with a set of reflexes. Those reflexes can get interrupted. Now when they're interrupted, now the body has to compensate. Anytime we compensate, we now are living not to our fullest ability. And now we have stressors in our body which can impact our health, impact our psychological processing, our emotional stability. This is why sometimes we get kiddos that their reflexes are off and they have tactile defensiveness or sensory difficulties. And so through these different modalities under the one, we're able to approach whatever the need may be. And then also the trauma part. So the trauma is a separate modality that we get trained under to deal with, whether it be past, present trauma, stressors, things that we don't even understand that we're going through. Overall, MNRI can help, like I said, anybody across that spectrum in different ways. And that's what's nice is that MNRI can be tailored to whatever that specific need is, whether it be spina bifida, CP, autism, failure to thrive as infants, because we can work with those cranial nerves, because often the inability to thrive is the sucking reflexes off. Breathing reflexes are off. Any children that are born C-section and don't go through the natural integration of what the reflexes should be, then those reflexes can be hindered. For example, if galant is off, which is what a doctor will test, they stroke down the spine of an infant, that parallel side should flex. Just simply that, if that is off in and of itself, compensations occur and the ability to focus then gets hindered. Those kids go on to often struggle with ADHD, for example. If you have ADHD, often we can see that paralleled with behavior disorders. So instead of just treating with medicine or medical procedures that might be out there for whatever these may be, we go with the body. We teach the body the reflex, we integrate it so that now the body isn't compensating. And anytime we have a broken pathway, we are then going to operate out of the brainstem. Anytime we're operating out of the brainstem or our survival mechanism, then what happens is we cannot access the higher learning. So whether it be speech, whether it be dyslexic issues, and immune disorders. Anytime we run under stressors for any period of time, we have inflammation. So MNRI is really incredible in that it gives the body freedom to go how it was naturally designed to function. So if you have any questions, you can go to the MNRI website, Svetlana Muskatova Institute, for example. A lot of data is there that is evidence-based research. There's a lot of examples or testimonials from people who have been able to go through this. So any questions, contact them, contact Newbridge Clinic, and we'd be happy to help you out.